Hello all, hope you're doing well today. Hey, today we are continuing our conversation in chapter 13. And so this is part 2, and we're talking about health-related careers today. To start our conversation out, let's talk about athletic training. So athletic trainers are healthcare professionals who specialize in preventing and treating muscle and bone injuries. They work in schools, universities, professional sports, and even hospitals and military settings. Certification and licensure are required, often through programs accredited by CADE, which is the governing body for athletic training. Now, athletic trainers, they help to develop sport-specific training routines to enhance performance and reduce injury risk. They monitor athletes' progress and modify programs as needed. They also work in providing guidance on proper techniques and injury prevention strategies and recovery protocols, and educate on hydration, nutrition, and rest as key components of injury prevention. And in preseason, they often assist with physical examinations. They help identify pre-existing conditions or risk factors that may predispose athletes to injury, and ensure that clearance and readiness for participation. They also check equipment and facilities for safety. They inspect athletic gear and protective equipment for wear and compliance with standards, and evaluate practice and competition environments for potential hazards. So they are so important. Now, their role as an athletic trainer is they help to administer therapeutic treatments and monitor progress. They apply the appropriate modalities of ice, heat, electrical stimulation, and ultrasound, and rehabilitation exercises. And again, they track healing and functional improvement throughout the recovery process. They're also important for providing emotional support and help athletes to set short-term goals to keep them engaged and optimistic, because they can get really down on things. And they help to build trust and foster resilience during setbacks or plateaus in progress. It's important that they keep records of injury status and the treatment program, so they document injury evaluation, the treatment plan, and the daily progress notes, and ensure communication with the coaches and physicians and other healthcare professionals. They do have a certification. They must be certified by the National Athletic Trainers Association, or NATA, which is the national certification. There are state certifications as well. You are more marketable if you have the national certification. It is more expensive, but you are more marketable, and you can work in any state, or through the Board of Certification, which is often overseen. NATA is associated with BOC. So other avenues are health and weight management clubs and spas. So typically spas are located in resorts and hotels and mineral springs and cruise ships. What fun! Making health and wellness services more accessible while people travel and they have leisure time. We provide a wide range of fitness activities, including graded exercise testing and personalized training plans, as well as instruction in various sports and recreational activities, and a diverse selection of exercise classes like yoga and Pilates, spin, and water aerobics. They also offer health and wellness services, so diet and nutritional counseling for sustainable weight management and stress management programs, including meditation and guided relaxation and massage therapy and other recovery services to promote physical and mental well-being. Now, industry trends, there is significant growth in these commercial centers and weight management programs, offering both in-person and online services. The integration of technology such as fitness apps and wearables really help in supporting client goals. Now, if we look at therapy-related careers in physical activity and health, we have dance or movement therapy. This uses movement to support emotional, cognitive, physical, and social integration. Often it's employed in mental health settings and rehabilitation centers as well as schools. Now, there's also therapeutic recreation or recreational therapy, and there's a master's that is associated with that. It utilizes leisure activities to improve physical and emotional well-being and helping individuals with disabilities or chronic illnesses gain independence and quality of life. Often it's associated with outdoor adventure or outdoor recreation kind of programs. But the idea is that it's like play therapy. Now, kinesiotherapy is it's rehabilitative exercises to help enhance mobility and functional capacity. And typically you're working with patients recovering from injury, surgery, or chronic conditions. Typically kinesiotherapy is more of a northern term in Canada that they utilize. We tend to use physical therapy more. It assesses and treats individuals to restore function and reduce pain and prevent further injury. And it involves manual therapy, exercise prescription, and patient education. And then chiropractic care, which specializes in diagnosing and treating musculoskeletal disorders, particularly of the spine. And it can include manual spinal adjustments, but also what you're seeing in some centers is soft tissue therapy. And so really working on working those knots out, those fibers that get connected, and working those out, and also prescribing exercise with that. And lifestyle counseling. Now, just be aware that in many of these careers, you're required to do, it requires a graduate program. And so there are prerequisites that may be required, such as anatomy and physiology. Now, for the exercise science and strength and conditioning, and then the pre-allied health degree plans, those are required on that degree plan for that reason. Psychology is another prerequisite for many of those programs. And so with that, you also need to know that usually for a graduate program, you need a 3.0 or better. If you're looking at PT school, it's so competitive. It's more competitive than med school. And so you have to have like a near 4.0. So you got to have blinders on. I think I've said this before. There is a growing demand that is leading to expansion of employment opportunities for professionals in physical education, exercise science, and sport-related fields, especially in the rehabilitative and wellness settings. So to stand out in this competitive industry, certifications, continuing education, and specialization are key. Whether it's learning about adaptive fitness, nutrition, or wellness coaching, or expanding your skill set, helps increase your job opportunities and earning potential. Now, I would recommend additional or supplemental coursework to go along with that. As we talked about, with courses in health, nutrition, psychology, anatomy and physiology, or public health. They can all enhance your foundational knowledge and broaden your career options. And professional certifications. Gaining certifications can boost your qualifications and credibility. Shape America, health and physical education standards and professional development for those of you who want to go into teaching. The American College of Sports Medicine, or ACSM, has all kinds of fitness as well as clinical exercise certifications, depending upon what population you want to go into or work with. The National Strength and Conditioning Association has different levels of certification as well. They have a military certificate if you want to work with military, and of course strength and conditioning and personal training certifications. And then NATA, so the athletic training certification. And then of course first aid and CPR, which is basic life support and emergency response skills. Nearly all of those certifications require that as well. And so you have to build on your individual interests and strengths. You want to choose electives and certifications and specializations that align with your career goals, whether it's in coaching, therapy, wellness, or performance training. And you want to gain practical experience. And so you're taking what you're learning in the classroom into the real world settings. And I find it really works both ways. You learn in those real world settings as much as you learn in the classroom. And so you will be required to do an internship at the end of your education, at the end of your collegiate career here, if you're planning on going kinesiology or sport management. Field work at placements are important. And just volunteering. There's a lot of things that you can do to get experience. And of course, part-time or summer employment. These experiences help in developing your professional skills, soft skills, as well as the hard skills. You're building your resume and expanding your network. While health-related careers offer many opportunities, we must recognize that access to both services and careers in the field, it's not always equitable. Socioeconomic status can greatly influence a person's ability to afford a gym membership or hire a personal trainer. In fact, the average health club member earns about $75,000 a year, a number far beyond the reach of many low-income families. This financial barrier highlights the importance of making wellness resources more accessible to underserved communities. Additionally, representation within health professions needs to improve. Currently, minorities make up less than 10% of certified athletic trainers. This underrepresentation shows the need for greater recruitment efforts and mentorship and support for students from diverse backgrounds pursuing careers in health and fitness. Another major trend in health-related careers is the growing emphasis on prevention and the integration of medical fitness programs into the healthcare systems. As more employers recognize the value of worksite wellness programs, we can expect significant job growth in that area. At the same time, medical fitness programs that offer a full continuum of care are becoming more essential. These programs not only help people prevent diseases, but also provide crucial rehabilitation services for individuals recovering from chronic conditions like diabetes and cardiovascular disease and stroke. This creates new roles for professionals trained in exercise science, health promotion, and clinical rehabilitation. As the health and fitness industry continues to evolve, technology is playing an increasingly important role. Wearables, fitness apps, and digital platforms allow professionals to monitor client progress in real time and adjust programs remotely and deliver personalized support. Additionally, virtual and on-demand training is reshaping how people engage with fitness, whether it's joining a group workout class on a lunch break or working with a virtual personal trainer. This flexible model meets the needs of busy lifestyles. Another growing area is health and wellness coaching. Many people are looking not just for workouts, but for guidance in making and maintaining long-term lifestyle changes. This creates opportunities for professionals who are skilled in motivation, behavior change, and habit formation. So in summary, the health-related careers, there's diverse career options. You've got athletic trainers, physical and occupational therapists, wellness coaches, virtual trainers, and growth in clubs, clinics, hospitals, corporate wellness, as well as digital platforms. Now, there is a rise in preventive care and worksite wellness, as well as medical fitness programs. And there's a growing need for rehabilitation services for chronic diseases. Now, as far as innovation and access, tech-driven monitoring, wearables, and on-demand training improve care, with virtual platforms expanding the reach and flexibility for clients and professionals. And then equity and representation. Socioeconomic status affects access to wellness resources. So minorities are underrepresented in many health fields. This calls for inclusive recruitment and education pathways. And lifestyle coaching is on the rise. So the focus on behavior change and sustainable habits and whole person health, increasing demand for certified health and wellness coaches. So there's a high demand for professionals in preventive care, rehab, digital wellness, and coaching. Continuing education and certifications are key to advancing in the field. And that is all that I have for you today. I look forward to talking with you again. Have a great day.